All right, thanks, Gil. Well, this is the first time Hartford HealthCare has chosen to recognize MLK Day, an important day of observance. And joining us today to talk about what this day means in terms of healthcare is Sarah Lewis, Vice President of Health Equity at Hartford HealthCare. Sarah, welcome.
Thank you. It's so nice to be with you today. Thanks for having me.
Great to have you. So how is Hartford HealthCare honoring MLK Day this year?
So for the first time for Hartford HealthCare employees, Martin Luther King Jr. Day is a paid holiday. One of our core values is equity, and we describe carrying out our responsibilities as a health system in an equitable way as doing the just thing. So today is an important and valuable opportunity for us as a community of healers to reflect on what it means to stand for justice every day in the work that we do.
And Sarah, tell us why it's so important for healthcare workers to take time to observe this day.
So Dr. King is known to have said that of all the forms of inequality, injustice in health is the most shocking and inhuman because it does lead to such poor health outcomes and even physical death in some circumstances. So we have the opportunity today to think about all of the ways that we can increase access to health care, that we can equitably approach disparities that exist in health outcomes and meet our patients where they are, and think about Dr. King's call to justice for all to join the beloved community and stand up for one another and see one another as full humans deserving of respect and dignity.
And Sarah, we should point out in our Yale interview just a few minutes ago, he talked about how equity in minorities is still not even. They're not getting some of the same COVID medications. So, all right, Hartford HealthCare has focused a lot on health equity. Talk to us about that.
Yes, so we realize that we cannot achieve full health for everyone until we focus on improving the parts of the system that have not worked for so many for so long. Right, this means being quite honest about where we see disparities in access to health care around the state, disparities in access, and disparities to health outcomes across the state, and then addressing those disparities with unique solutions. Right, so COVID revealed to us finally that that one-size healthcare does not fit all. So we have to be creative. We have to be innovative. We have to meet our patients, our community members where they are. So an example of one of the things that we've been doing recently from that perspective is something that is both a trust-building exercise and also a community health-building exercise, which is our Neighborhood Health Initiative, which partners with local communities, trusted partners across the state, where we can meet our patients where they are. It's a mobile sort of approach to health that came out of our approach to COVID when we saw the drastic numbers of how COVID was affecting Black and Indigenous and people of color, that we needed to do something differently. And so that's the sort of flexibility and the innovation that we're trying to bring to health equity, and always doing it in lockstep with community partners.
All right, Sarah Lewis, thank you so much for bringing us up to date. We appreciate your time.
It's my pleasure. Thank you so much.
Thank you.